Join the conversation.
You're with Cape Talk.
It is 9:35, nearly 9:36, and time for the Naked Scientist. That huge appointment on a Friday morning. Dr. Chris Smith is a lecturer at the University of Cambridge. Welcome. Good to have you back.
Good morning. How are you?
I'm great, thank you. Loads of questions that have come through this week we're going to put to you as well. But people want to just understand what the stature of your tenure with the University of Cambridge.
We're still waiting,
is
Clarence. We've got to the end of the consultation period now, so we're still waiting to see what the verdict's going to be. But I'm expecting to be able to announce a plan probably in the next week or so. So I'll bring you up to speed next week with where we are once they actually tell me what the timeline is and everything. But I'm expecting that they're going to be talking to me soon. So I can't say any more than that. I don't know anything more than that until I talk to them probably later today. So we'll find out.
Okay, that's cool. That's three other questions and answered. I did mention a little earlier this morning about just going around to certain pharmacies this morning looking for a specific bronchodilator that I've been literally using for decades and finding out that it's been discontinued. And I see some other people are now, well, they kind of going through the same thoughts that I'm going through. Ramsey writes, I'm in the same boat regarding my asthma, discontinuing of the bronchodilator that I normally use, Barotech. So I had no choice but to use another inhaler. Don't know how effective this one is. Yeah, I thought I'd just put that to you. It looks like it's an international discontinuation of a big brand. Do you know anything about it?
I'm not familiar with the brand itself, but what I can say is that the way medicines tend to work, unless you've got a drug which is still under patent and therefore only produced by one company, many of these long-standing drugs, and if you've been taking this one for decades, this will be what we call a generic version of the drug. Once a drug drops off patent, so the company no longer have exclusive rights to make it and no one else can copy it, legally at least, then anyone can make that molecule. And you see this with paracetamol, for example. Acetaminophen is the molecule which we call paracetamol, and anyone who's legitimate can make that and market it as paracetamol. So many of these drugs that we're using are now generic drugs. And the benefit of them being generic drugs is that anyone can make them, so the price tends to be very low, and therefore they're very affordable and very available. Certain brands will make them, and they'll market them under a brand name, a trade name, but it's still the same molecule. And so if you actually look on the packet, you'll find that there is a drug identification, a specific number or code that relates to that particular drug. So if the bronchodilator you're referring to is salbutamol, for example, that's the actual active drug. Yeah. Well, it's the same molecule, whether you buy that and it's got a packet saying one thing on it or a packet saying another thing on it, you'll see the drug identifier is the same. So even though that particular brand name may not be available because the company has sold the rights or the company has decided to discontinue manufacture or distribution, there's a whole range of reasons why this happens. Others will have picked that up or they'll pick up the market and it's the same agent. So in theory, you're getting the same drug. A paracetamol in one packet is the same as a paracetamol in another packet. It has to be legally. So if you go and find something which is the same molecule, same drug identification code, and the same dose, critically, and the same delivery device. Remember that there are different ways of taking these bronchodilators, and you might have found one that works really well for you and you've got the technique off pat. Make sure you stick with the same delivery device, but you should be fine with a generic drug like that. It's just the packet that's different, but the molecules that are going into your chest and making you feel better, they're going to be identical. So I hope that gives some reassurance to people who are in that sort of situation.
Yeah, the active ingredient in this particular instance is phenotryl hydrobromide. So maybe we should go and look for that active ingredient instead of the brand then. Jenny J writes, do you know how effective ivermectin has been against cancer? And why is this not being publicized?
Ivermectin rose to prominence during COVID because it was one of the agents that was touted as a possible anti-COVID agent, along with other things like, if you remember, hydroxychloroquine also was touted as a possible therapy. When these things were subject to proper, rigorous, blind trial evaluation, one of the main actors in that was the University of Oxford's recovery trial looking at these different agents. They failed to find evidence to support the use of these agents during COVID. I don't know what the status is with ivermectin, which is actually used as an anti-parasitic drug. It targets worms. And whether that would have anti-cancer effects as well, I don't know. It's not an unreasonable question to ask, because you think, hang on a minute, why would a drug for worms and parasites have anything to do with cancer? But increasingly what we're finding is that some drugs have what we call off-target effects or side effects that turn out to be beneficial. People are now building big databases where they look at what conditions people have and what drugs they're on for those conditions, and then what other conditions they do or don't develop. And what you sometimes see is people with condition X who are on drug Y have a much lower likelihood of developing another disease than they ought to, based on what you know about people with their sort of clinical history. And when you then look into this in more detail, you find that one side effect of that drug isn't a bad thing. It's actually reducing the risk of another disease entirely. So there's now a whole industry looking at off-target effects of drugs to see if we can give a new lease of life to an old drug. And the benefit of doing this is if we've got drugs that we've already put through clinical trials, so we understand the safety profile, we understand how well we can or can't use these things, who they're suitable for. If you can then find another beneficial indication for that drug, it saves an enormous amount of evaluation and safety testing, because you can go straight to market with it and start using it. So there is a big industry behind this, but I don't know whether or not there's any evidence base behind ivermectin, the antiparasitic agent, and indications for cancer. Very happy to take that away and have a look as a homework option for you, if you like, for next time, and see if there's any evidence base around that. And speaking of homework, you haven't asked the H word yet, so I'm going to bring it up. Last week we had a question which was about batteries, and specifically about sodium-ion batteries as alternatives to lithium-ion batteries. And I said, well, I'll take that away and have a look, because I'm not familiar with that industry. I had a little look into this, and sodium-ion batteries have been around for a while. The technology is very, very similar to lithium-ion batteries. The principle is that you have a battery, which consists of an electrolyte, a liquid substance, two electrodes, one of them, the negative one, made of sodium, and a positive one made of something else. When you charge the battery, sodium ions, which are sodium particles, which are in the electrolyte, migrate to the positive electrode and are pushed onto the positive electrode, where they store energy. And when the battery discharges, they come off of the electrode and go back towards the other electrode, the negative, and this is how the battery discharges and returns the energy. One advantage is that sodium particles chemically are very similar to lithium, because they're in the same part of the periodic table, but sodium atoms are bigger than lithium atoms, and so therefore they are not stuck into the electrodes quite as much as lithium. So there are some advantages of using sodium instead of lithium. Also, the relative abundance of sodium. There's loads of sodium in the environment. It's very easy to access. Lithium is geographically more limited, and it's harder to get at. And there are various geopolitical issues around the recovery of lithium as well. So this is why people are interested in pursuing sodium as an alternative, but the industry isn't as well developed and advanced as it is for lithium. But people are looking at all these options, because batteries are the limiting factor between and behind many of the devices in the modern era, and having better batteries, we think, will really help to accelerate many technologies. So it's very much something that's under active investigation.
We've got a voice note in from John, and I know this is an issue that appeared on the radar this past week. We had discussed it, and I'm glad it's returning for the Naked Scientist. Let's take a listen.
Morning, Terence. Morning, Dr. Smith. It was mentioned on Cape Talk a couple of days ago or it was yesterday, that the Earth is rotating slightly faster. And I mean slightly faster. So what does that, so does a minute change? Is a minute no longer 60 seconds? Or how does it work?
Hi, John.
I'd like to know. Thanks, guys. Cheers. John Kelsriver. Bye.
This came out earlier this week, and it got reported to variable levels of accuracy. So actually, I decided to look at this for the Naked Scientist podcast this week, which I'll put out a program on the Naked Scientist website later today. I interviewed David Gossard, who's a researcher at the University of Western Australia in Perth. He's a friend of mine. We first met 10 years ago, but this is very much his bag. And so I spoke to him last night about it, and you can hear what he had to say in more detail on The Naked Scientist later today. But I'll summarise what David said for here, which is there are 3 days across the next month where a day will be slightly shorter in time terms than it would be normally. Normally, it takes the Earth 86,400 seconds to turn round once. But on the 9th of July, a couple of days ago, on the 22nd of July, and on one day in August, then the day will be about 1 to 1.5 milliseconds shorter. In other words, the time it will take the Earth to rotate on its axis once will be a fraction of a second less, because the Earth will have speeded up transiently. And you might think, well, hang on, why would the Earth suddenly start spinning faster? And it's all to do with the Moon. In the general scheme of things, because the Moon sits outside the Earth and the Earth turns inside the orbit of the Moon, the Earth is giving energy to the Moon. That's why the Moon is moving away from the Earth by about 2 centimetres every single year, because the Moon is making tides. Tides exert drag on the Earth, and that drag slows us down and gives our energy to the Moon, slowly. But the Moon doesn't go round the planet in a perfect flat shape around the equator. The Moon is on an eccentric orbit, which is closer to the Earth in some parts of its orbit, farther away on others, and tilted, because the planet's tilted. And the consequence of that is that sometimes, by chance, and when you also take into account the redistribution of water around the Earth's surface in the form of ice sheets increasing their deposition, the Amazon River basin filling up in the rainy season in South America, the redistribution of mass around the Earth and that strange orbit of the Moon means that sometimes we actually end up with the reverse effect happening, and the Moon tugs on the Earth in a slightly different way and speeds it up. So we speed up transiently sometimes, but the general scheme of things is the Earth is slowing down. And on those days this month ahead, we are seeing a slight increase in the rate of spin of the Earth, which will then reset back after the event is over. And we have known about this for a really long time, and this is where the concept of a leap second comes in, because what scientists do is they wait until these inaccuracies add up to about 0.9 of a second, and then they say, right, well, add or subtract a second from the time clocks that we're running, our international clocks, to keep us in sync with where the Earth is on its turn and relative to the stars. But we don't really need to do that, and by about 2035, the international community have decided they're going to stop worrying about this and abandon the leap second. So make the most of your leap seconds while they're still with us. They're not going to be with us forevermore.
You are with Cape Talk.
Views and News with Clarence Ford.
It is The Naked Scientist, Dr. Chris Smith, lecturer at the University of Cambridge. It's his time. And Keith, of course, wants to know why you can't use your cell phone around gas stations or fuel delivery trucks.
This is really a legacy of a bygone era where we were much more careful about phone use in various places, hospitals and petrol stations. There's some elements of kind of common sense behind this. One of them being, if you're fiddling around on a phone, you're probably not paying attention to what you're doing. You're more likely to misfuel your car. You're also more likely to step in front of another car and get hit or make a mistake in some other way. You might therefore put yourself in a more dangerous situation. And when you're filling a car up, you want to make sure you don't make silly mistakes. So it's better to have your full attention on that. And if you're rabbiting on a phone, that might not happen. So that's one reason of it. The other is less likely to happen now, but with older phones, you probably remember those days where you dropped your Nokia brick. And what did it do? Disintegrate, and the battery popped out, landed on the floor. There was a possibility that when you're doing that and you drop your phone and the battery pops out, you will create a spark. And since a petrol station, because of what you're doing in a petrol station, has an above average concentration of petrol vapor, which is explosive, if you've got a source of ignition like a spark, you could detonate the petrol station. That was the risk assessment reason for why they should avoid using mobile phones in a petrol station. The risk of that happening, we now acknowledge, because of the phone design and so on, it's very, very slight. And I'm not aware of anyone actually ever having ignited their petrol tank with their mobile phone before. Much more common was people igniting their petrol tank by causing static discharges off of themselves. And in fact, there was a whole sequence of videos that were published of analysis of forecourt CCTV, where in petrol stations where people could put the filler spout in the car and lock it off so it would keep fueling until the car was full. What people would often do is then get back in the car, slide into the seat, and then when the car finished fueling, they'd slide out again, go and touch the filler, and because they were sliding backwards and forwards across the seat, they would statically charge themselves, and then when they touched the filler, which was earthed, they would create a spark, and all the vapour that's come out of their fuel tank filler nozzle would then ignite, and that caused fuel tank fires. But again, the risk of that happening is very, very remote, but these things are all... The guidance is there because a 1 in a million is all it takes to be really rather devastating. So it's better to be safe than sorry. And that was the thinking behind it.
We got a voice note from Keith.
Clarence, do you want to ask the naked scientist, Dr. Smith, about does he know anything about bird flu or this avian flu that everyone's panicking about? And maybe just add a foot and mouth as well. Thanks very much. It's Keith from Gordons Bay.
Hi, Keith. The answer to this is that we are very concerned about bird flu at the moment, and specifically the form of bird flu called H5N1. Slightly flown under the radar because of COVID and eclipsed by other international events, but we've been through in the last about 5 or 6 years the worst bird flu pandemic that the world's ever seen. Literally billions of birds around the world have died of H5N1 bird flu. But what's got people really spooked is that it appears to have settled in North America and done something a bit different, which is that the flu has now spread into wildlife, and specifically mammals like foxes and badgers, and it's also got into bigger mammals, cows. And it's doing something really interesting in the cows because it's become a milk-borne illness in these cows. We don't exactly know the mechanism behind how this has emerged in this way, but the virus appears to have adapted to infect cows through their udders and spread between animals in milking parlours on the milking devices. And so the virus infects the udder tissue, sheds in the milk and on the udders themselves, infects the milking device so that when the next cow comes along, it gets infected. And they've seen a number of cases, significant number of cases that way. Obviously, if you've got a big mammal that has close contact with humans, which includes farmers, farmhands, but also consumers of unpasteurized milk, which is trendy in some parts of America, there's a bigger risk that the virus could then make the jump. If it's already made the jump to a big mammal quite similar to us, it makes it easier and more likely it could more easily jump into us. At the moment, there have been a handful of cases. There have been a couple of deaths that I'm aware of from H5N1 in America from this, but in those people who have succumbed, it's been individuals with pre-existing poor health. So it's not a fatal or lethal illness at the moment for humans who are in previously fit states. So at the moment, we think the risk remains no higher than it was previously. We know H5N1 is a threat to humans. We're keeping an eye on it because it could spawn a pandemic. This behaviour, though, in cows has got people worried. It shows the virus is continuing to adapt, and for that reason, we need to be very cautious and keep it under surveillance.
And on that cautious note, we've got to call it today. Big thank you to The Naked Scientist. You want to check The Naked Scientist out on nakedscientist.com. Is that right, Chris?
It certainly is. And each week on Friday, we publish a roundup of the week's news. So if you like to catch what's happening scientifically news-wise, there's a half-hour programme every Friday afternoon to evening, which is a snapshot of some of the biggest science news stories. We actually go and talk to the scientists behind the stories. So you actually get the story from the horse's mouth, not just sort of reported on. You can actually hear us asking them questions. And on Tuesday, we tend to publish a sort of topic-led analysis of something that is important in the scientific sphere. But tune in today and you can hear all about why the Earth is going to speed up slightly once again later this month. nakedscientist.com.